Good evening, you're watching The Last Word. I'm Sanjana, and tonight, just like every night on The Last Word, we'll be focusing on mental health. The emotional impact that the coronavirus is having. Now, understandably, it's taking a toll on most of us. We don't know what to do when we're socially isolated. We don't know what to do when we're quarantined. For how long can we continue scrolling on our phones mindlessly? For how long can we exercise at home? For how long can we eat home-cooked food? For how long can we endure our family members? And for how long can we control and suppress our anxiety and other mental health challenges that we're having? Now imagine this. Imagine a population, rather an extremely special demographic that is on the front line, that is dealing with people who are infected, that has to, make peace with the fact that they may not see their families for really long. That has to make peace with the fact that they themselves could be infected in their line of work knowingly. That they may be infected because hospitals don't have enough equipment. That they may also be infected because protocols, rules and advisories keep getting changed. So tonight, viewers, we're going to be focusing on the mental health and the emotional well-being of an extremely special group of people. Our healthcare workers, our medical staff, our doctors, our nurses, our Anganwadi workers, people who are putting you first before they put anything else, people who are only fighting the coronavirus so that you and I can stay at home. So while we have been focusing on different aspects of anxiety and controlling stress during this difficult time, it is also important and imperative that we not only respect the kind of work that our medical staff and healthcare workers are putting in, but also understand how they themselves can deal with it. Let me quickly introduce our panel this evening, but before I do that, another appeal to my viewers: please stay safe, please stay home, and more importantly, if you have any questions, if you have any queries, if something is bothering you, if you're not feeling all right, please feel free to call. We have a panel who hopefully can reassure you in some way. The numbers are flashing on your screen. So let's get right into it. My guests joining me this evening are Dr. Saida Ruksheda, psychiatrist and psychotherapist at the Trellis Family Center; Dr. Malay Dave, consultant psychiatrist in practice; Dr. Srinivas Rajkumar, General Secretary of AIMS Resident Doctors Association; and Purushottam Gawande, the father of Dr. Amit Gawande, is a pulmonologist and an insensitivist, and currently head of ICU at Sujay Hospital, and the consultant pulmonologist at the Sujay Hospital and Criticare Hospital, Apollo Clinic, Beams Hospital, and Mahavir Hospital. Now, he's presently going to work every day to make sure that non-COVID patients admitted in hospitals are safeguarded by the virus, and also taking care of the staff for the same. So thank you so much, for that. And, ordinarily I would obviously go to our expert on the panel, but tonight, particularly considering that, we're also focusing on the mental health of an extremely special group of people. Mr. Gawande, I'm going to come to you. You are the father of somebody who is shouldering all of this responsibility. I can't imagine it is easy for him or for you. Do you mind taking us through what exactly you're going through right now and what it is to see your son every day going to work knowing that he may or may not pick up the infection?
Yes, madam. Nowadays only many agencies are coming. They are coming on field and they are doing well job. So first of all, these policemen, police staffs and doctors, they are doing very good job nowadays. And being a police officer's son, Dr. Amit, so I am proud of him, doing the noble duty for the needy and affected persons. We family members are much worried as he is constantly coming in touch of many persons daily. But at the same time, he is also taking care of all our family members, that when he return back to home in the evening, he rushes to bathroom first, removes all wearing clothes for washing, and after taking a bath, then only he meets us. And he is giving all the suggestions, all the precautions, what do we have to take. He is always guiding all the family members. We are also okay. I'm much worried about him, and he's also much worrying about him. But nowadays, he's doing a noble duty for the noble cause. So I'm proud of him.
Thank you, Mr. Gawande, for sharing that, and really hats off to you know your dedication, your son's commitment, and more importantly, how you're dealing with this. Dr. Rukshada, it's a whole different level of lonely from what most of us are actually dealing with. Healthcare workers, they're at the front line. So, unfortunately, circumstances don't seem to be changing soon. We all know, as we have been saying almost every day, we're all in this for the long haul. So, what can we do to make it better for the medical workers, for healthcare staff, for the doctors, for the nurses?
The first step is always awareness. When they know that they're there and they are going to be doing the most dangerous work of all in these times, and they also know that they're going to be there for a long period of time, they also need to be aware that there is a possibility of burnout. And there is a possibility of burnout not only because of the kind of work that they're doing day in and day out and long hours, but also at the back of the mind, every health professional, whether that's a doctor, whether that's a nurse, whether there's a support staff or anybody else driving the doctors and the support staff to and from work, they're all exposed, and they know that they are also going to come back home and maybe, hopefully not, but bring back the virus home as well. So that in the back of the head, that goes on and on, that increases the stress and increases the burden that they feel. And so it's important to understand that there can be burnout emotionally as well as physically, and the emotional burden kind of creeps up on us. It can be very insidious and slow, just like the virus. So the awareness is important. If you know that it's getting to you, if you know that you're getting tired mentally, physically, emotionally, take a break. Even though you know that you don't have the time to take a break, but take a break. You taking that break is going to be more important for you and the people that you can help and save than not taking that break. So be aware that there can be burnouts. If you're already somebody who has some amount of anxiety or depression or something else, or other pre-existing medical conditions, you need to be extra careful with yourself, physically as well as emotionally, because if you're not okay, if you're not feeling well, your immunity is going to go down. Most health professionals kind of know this like in their heads, but they don't really practice it because they're so used to putting somebody else before them. And this is not one of those times that you can neglect yourself at all.
Absolutely. Let me actually come to you now, Dr. Srinivas Rajkumar. I believe you also spoke with us a couple of days ago when a lot of doctors came forth and very unfortunately and tragically were complaining about the kind of discrimination that they were facing, the kind of stigma that they were facing. A lot of them were asked to leave their rented homes. People were ostracizing them, and all of this out of the fear of coronavirus. And it just seemed so much in contrast to what was happening on Sunday when all of India came together, to applaud, people like you and so many other people who are working on the front line and risking their lives, to treat people and, make them healthy again, only to treat them like this. So understandably, obviously, that has affected, or if you can let me know, how has that affected the morale of the doctors who are working tirelessly and working so hard? And what do you think are the effective steps, not just the government, but all of us should be taking so that, they're more at ease and they are more reassured?
Actually, the response after the incident was very positive. Home Minister Shri Amit Shah ji personally called me and informed that if such incidences continue to happen anywhere in the country, there will be personal intervention from the Home Ministry, and also police personnel would be deployed to take immediate action. And again, we have had so much positive responses from landlords and also hotel chains to support the doctors who are facing such issues. So overall, the response has been overwhelmingly positive. And again, the message put forth in your own news channel regarding the awareness that doctors and healthcare workers don't pose additional risk. And the parent of a doctor who spoke just before me put it rightly that doctors who come back home take adequate precautions, they clean them up, they remove the dresses, and then start interacting with family members and also the neighborhood. So the good message was put forward, and that has resulted in a very good positive response. I hope the country maintains that and treats their healthcare workers right in this time of need.
Okay, yes, I agree that the government response was pretty, swift. But Dr. Dave, we're also looking at, women and nurses. I was looking at a couple of reports that said, especially severe symptoms, are faced by them because perhaps not surprising, they're often called on to do the extra emotional labor, like keeping up, a steady stream of reassurances. They suppress their own feelings, which is obviously known to take a toll. So how do you come back from something like that?
Women, whether in the nursing professions or elsewhere, have too many tasks on hand, and it's difficult for them to handle everything with the same level of so to say expertise or proficiency. And now, since we are dealing with a pandemic, the responsibilities are added on. When we are looking at the nursing profession per se, uh, they are looking at many things. They are doing many things. One is that they will take the orders from the doctors, whether it is medications or anything apart from the medication that needs to be done for the patient. The second thing they do is they would actually give the medicines or see that the routines of medicines, IV fluids, whatever is needed is done. Many times it is the nursing staff which is the first, so to say, point of contact for the relatives. So if the relatives are apprehensive or if the relatives have some questions, probably the nursing staff, because they are there all around. They are there around all the time, uh, whatever are their duty hours. So it's not only managing the patient directly, but they also have a lot of other things to do and to do it well, because a doctor will order something and it is for the nursing staff to implement it and to see to it that there are no mistakes, and if there are any issues or something, it is brought directly to the attention of the doctors. Uh, in addition to this, they also have to look about after their own safety, their own the precautions that they need to take when they're interacting with such patients. They need to see to it that they are communicating at their best with the relatives. And after all these things, when they go home, all the duties that would be there in the household are also looked after by them. So they are a specifically vulnerable population, and it is actually thanks to them that whatever doctors are doing gets implemented well. Uh, it is quite natural that in a situation like what we are facing now, because of the added burden, they'll be very stressed, and they also need and and if you look at the numbers of people that are projected to become ill and the kind of services we have, we are short of nursing staff. In fact, we are short of all medical personnel. But more and more of the work would be on their shoulders now, and they have to see that it is done. They have to see it through. So a very vulnerable population, they need to take care of themselves. Uh, it's the same thing that's repeated everywhere. They need to see to it that the precautions that they advise to their patients, to their family members, are the same ones that they take into account. Frequent hand washing, all the gear that is available for them um, is properly used. And of course, since they're the absolute front line of managing things, the problems of anxiety, burnout about their own good, about the worries about their families are also to be taken into account.
Right, Dr. Dave, thank you so much, for putting that in perspective. Let me quickly come to Purushottam Gawande. So, are there other your friends or your relatives who are also in similar situations where they have children who are currently serving as doctors or are in the front line? When they speak to you about how you're feeling, or they, kind of check in with you about how you're doing, or if they turn to you for advice, What is it that you tell them to reassure them and, make them feel better? I'm sure a lot of our viewers would also want to know that, I'm sure a lot of our viewers also have people or relatives who are, doctors, who are medical staff or loved ones who they don't know, for how long they may not see them for. So, what kind of advice would you give other such people?
Hello, I can't hear you properly. Hello.
Mr. Gawande, can you hear me now? Okay, we seem to be having some issues with the audio there, but let me quickly now get in a question from Dr. Ruksheda. Dr. Ruksheda, do you think that we now need to perhaps have the time has come to have special interventions to promote mental well-being in healthcare workers that are exposed to COVID or working with people who are infected with COVID, or just anybody who is a healthcare worker currently, with women, with nurses, and of course with the frontline workers requiring particular attention more now than ever?
I'll share some personal anecdotes. So in one of our groups of the doctors, so the physicians and the pulmonologist and the interventionist, we were all chatting, and they said that after this, we're all going to have burnout and PTSD, and we'll all need you, madam. And I said that don't worry about it. You work now and I'll work later. You were talking about women and women health workers. A friend of mine, she works in one of the BMC setups. And on the way, the first day of the lockdown, she was very, very upset and very scared and worried how it's going to be, because it hadn't started yet. She hadn't experienced that yet. And she was also worried because she has a young child at home. And luckily, her husband is not a doctor who can stay at home, and he's working from home. And I told her that, what, don't worry about it. He's going to figure out how to take care of your daughter. And even though there are no domestic helps and support staff, but forget it. He's going to, motor through and power through. And that's what we as women also need to kind of learn. Give it up. Let the other people, let the other family member pitch in, and they'll sink and swim, but they'll learn to swim, and they'll take care of the other emotional burden and the physical burden of the household activities. I have a nephew who's in KEM in the emergency ward, and the first day that it was announced, the 21-day lockdown, he messaged his mother saying, how are you? You're not panicking, are you? So you understand that even the frontline workers, while they are working and they're there and they're doing what needs to get done, but they're also somewhere looking after the mental health of people back home as well. My sister is a doctor as well, so she understands the kind of gravity of the situation a little bit more better from lay people, but she's also a warrior. As far as whether mental health workers themselves are equipped to handle their own mental health, health workers, unfortunately the curriculum hasn't really been very supportive of that. We hope that they have enough friends and colleagues on campus or off campus that they can reach out to. But again, to even recognize when they would first need that to reach out to other people is sometimes a challenge. And that's why we are trying as much as possible to be there for our colleagues and be there for our colleagues' families and be there our colleagues and try and remind them that take a break, do something fun, even if it's for 5 minutes. Don't scroll. Use social media very, very focusedly with something that might benefit you, that might make you feel a little better. So yes, I mean, they're not equipped to handle the emotional burden, frankly, also because we've never faced something like this before, isn't it? I mean, we've read things about the plague and the influenza and
Correct.
the Spanish flu and the American flu in books, but we've never really lived through this. My nephew's there where I was 20 years ago, and I didn't go through something like this. So one is never really prepared, but one should also understand that to take care of other people, you need to take care of yourself. And most health workers do know that. Unfortunately, they also tend to sacrifice themselves. So this is not the time to be a martyr. And we'll try and keep doing our bit and lend our services and be there for our friends and colleagues and family, and hopefully they'll reach out and actually take our help.
Absolutely. And I really hope that they do. And please, once again, viewers, if you know anybody or if you yourself are going through something that is unsettling, please feel free to call. The numbers are flashing on your screen. As you can tell, we have an expert panel with us this evening who can hopefully put your mind to rest. Even if it's a little, but please, we're there to reassure you. Dr. Rajkumar, do you think that there should be sustained counseling that also takes place currently right now? The same question that I posed to Dr. Ruksheda, because not only is there anxiety and stress, as we rightly have been pointing out, and probably we can imagine, but like Dr. Ruksheda said, this is also happening for the first time. It's unprecedented. None of us none of us have ever gone through this, so I can't even imagine what people are at the front line are imagining or having to deal with. Because coupled with, like I said, anxiety and stress, there's also an issue of self-esteem, of whether an assurance of whether do I actually have this, because we're seeing a lot of doctors who may not necessarily be trained to fight or combat the coronavirus, but now are having to, fill in whatever shoes they can and don whatever stethoscopes they can and just put on the coat and just go to work. So are you sensing that as well in your team? And do you think that perhaps, there should be a concerted effort towards, boosting the morale of doctors as well right now?
Yes, I agree that this is a very unprecedented situation, and the world, as we know, has changed in front of our eyes, and we are asked to face this pandemic. And myself, being a psychiatrist, I am also in duty. So from today, we have been provided the preliminary training about how to wear the suit and how to work with the suit, how to take sample for the suspected patients. So it is really unsettling for most of the individuals who have not been doing these regular duties to kind of manage coronavirus patients. But it is also known all over the country that all institutes are arranging specialized training programs. So all healthcare workers, doctors, be it of any specialty, are able to pitch in and do their best to combat the virus. And again, as I already emphasized, the issue of ostracization has decreased. Maybe in the initial phase, people were scared of this issue because they were the only person on the road while the whole neighborhood was kind of in their homes, in the comfort of their homes because of the lockdown. But gradually, people are beginning to understand the importance of healthcare workers, police, and other people who are out in the ground while they get to be in the comfort of their homes and watch the news. So things are improving, and it is also very difficult for healthcare workers also to wear the suit, which is very different. They have to wear it continuously for 6 hours, which is extremely prohibitive. They cannot move, they cannot use their mobile phones, they cannot communicate or do the things they can usually do. So it is difficult time for healthcare workers, but duties are structured in such a way that there is adequate rest between their shifts, and also after 1 week of duty, they will be in observation for the next 1 week. So there are sufficient facilities in place so that healthcare workers don't have burnout and they are able to discharge their duties satisfactorily.
Absolutely, and I hope this actually continues. Dr. Dave, do you think that the lack of medical equipment, now we know that there is a shortage of masks the world over, and perhaps this is why there has been a constant appeal to tell people. Sorry, I'm sorry, we seem to have lost the line there with Dr. Dave. We're going to try and get back to him in just a moment. But I believe Mr. Gavande's line is up and clear with us once again. Mr. Gavande, I had asked you this question earlier, but we seem to be having some audio problems at that point of time. It must be difficult as a parent to witness your son go in every day, risk his life, and more importantly, take care and shoulder the responsibility of so many other people that he needs to, keep safe, keep away from the coronavirus, be it patients, be it his own staff. Do you have other people around you who are also in similar situations? And if so, just like so many of our viewers who probably are in that kind of situation where their loved one is on the front line, what kind of advice do you give them? What is it that you tell them to reassure them?
No, see, ma'am, see, many police officers, see, I was earlier in police department, so many police are on the road now. And their family members, they are also asking to my son, doctor, what prevention we have to take, all these things. So I have given the number to all these my persons who are known to me. See, we have a WhatsApp group, we have a Facebook, and I am linked with 18 buildings around my area. That is, our association is there. So they all are with us. So by getting all instruction from my son, I'm giving all information to them all. And I have given the number of my son also. If you have any problem, any type of problem, so you have to contact to me or my son on telephone. So we are just, by that way we are helping, and we are taking all these things from the persons who are needy and who are around us.
Hello. Okay.
So do you ever feel that you ever feel worried that your son is perhaps at risk? Does he feel worried? Is he upset? Is he anxious? Is he stressed? As a father, what kind of advice would you give to, say, other parents also whose children are doctors? Like Dr. Ruksheda just said, her nephew, he's only 25 years old. His mother understandably is very worried. So what kind of advice would you give, other parents of doctors whose children are out there working?
No, I am giving advice, and I am requesting to all those parents that don't be a panic. Your son, your daughter is doing a very good job. He is doing a noble cause duty, and they should not worry about them, and they should just strictly follow the instructions given by their son or doctor. Okay, so I'm again and again advising them and requesting them not to worry, and everything will be fine.
Okay. Okay, Mr. Gawande, thank you. That's a positive way of looking at it. Let's also
Hello.
quickly say good evening to
Hi.
another special guest that's joining us all the way from America, where the situation has understandably gotten grim. But there are heroes on the front line who are fighting hard to combat it. Let me quickly say good evening to Dr. Sarah Pachtman Shetty. She's an MD and maternal-fetal medicine physician at Northwell Health in New York. Good evening, Dr. Sarah. Thank you so much for joining us. And more importantly, taking time out, not only with the time difference, but also out of what you're doing right now. I understand this must be a terribly busy and, more importantly, an emotionally draining time for you at this point. So the situation is quite grim in America right now. So what is it, if you can take me through what's happening at your hospital, just a sense of what's really going on ground?
Hi, thank you so much for having me. It's an honor to be here. I live in New York City and work in New York City. It is the epicenter of the viral outbreak right now. We have many patients in all of the hospitals that I work in who are sick with coronavirus, and our system is a bit overwhelmed right now because of the volume of cases that we're seeing. I am a pregnancy specialist, so I work in an ultrasound unit, and I'm seeing a lot of women. We're continuing to offer care and take care of these women as best we can.
So Sarah, understandably, from whatever I'm gathering, this seems to be a problem the world over, and it was something that I was opposing to the other doctors as well, is the lack of medical equipment, the constant changing hospital protocols. How is that, having an impact on the mental health of a lot of doctors? Because there's not enough masks, there may not be enough equipment. We're seeing a lot of doctors don new avatars, trying to do different trainings, stuff that perhaps not even been trained for, or have to deal with this before. So what kind of emotional impact is it having on the doctors, and more importantly, what are you guys doing to stay positive?
So I think the emotional impact is one of the most challenging parts of this pandemic, and it is affecting patients and doctors the world over. definitely there is the pandemic of the virus, but there's also the pandemic of the fear and the resultant mental health issues that we're seeing and difficulties with anxiety and depression. I will say that me and my colleagues are very pressed. It is a really tough time. There's a lot of anxiety and pressure and scared feelings that go along with it. But we are doing our best to maintain hope and to be there for each other, virtually, of course. As far as the lack of gear and masks go, there's definitely shortages across the nation here in the United States. We are getting grounds of people donating and being provided with gear more and more every day, and I hope it continues. We're going through it very, very quickly, and so the more we can get to keep ourselves and our patients safe, the better.
Sarah, before I let you go, and understandably, you're at work and you're dealing with a lot right now. So thank you once again for taking out the time. These circumstances are going to be there, from what I understand, for quite some time right now. We're in this for the long haul. At least in India, we're all quarantined, and we've been told to maintain social distancing at least till the 15th of April. We don't know whether that's going to be extended. Obviously, this is also putting a lot of pressure on people on the frontline, medical staff, doctors, nurses. What can the general population do to make it better? And what would you say, you wish maybe the authorities or anybody else had done to make it better mentally, mental health wise, for you to feel more reassured and more comfortable?
Good question. I think that the social isolation, while it definitely contributes to loneliness and feelings of hopelessness and worry that go along with the whole pandemic, I cannot stress enough, from what we're seeing here in Long Island and in New York City, that social distancing is just the most important way to protect the spread of the virus and to protect the healthcare system and to protect our elderly members of society and our communities. And I think that while it's isolating and quite scary, connect with your friends virtually, be there for each other via Skype or text, and check on your friends. I mean, your extroverted friends are having more trouble with this right now, and it's really tough to feel alone. But in the long run, I think the safety kind of comes first right now. And as long as we all are there for each other in some kind of way and can check on each other, we'll end up better in the long run.
Dr. Sarah Shetty, thank you so much for joining us this evening. I'm going to let you get back to it, and please stay safe and take all the preventive measures you can. And thank you so much once again for taking out the time. I understand Dr. Dave is back with us. Doctor, we heard from Dr. Shetty over there all the way in New York talking about how the lack of medical equipment is also an issue. And I understand that that's probably an issue in India as well. That is something that we have been grappling with. There's changing hospital protocols. The situation is completely unprecedented, not just for us. So it must be even more, stressful for people at the front line. So in a situation like that, then how does one come back from that? And more importantly, if you can just kind of stress on what, workers and, healthcare workers can actually do to alleviate themselves of that kind of anxiety that they're feeling.
It's unfortunate that there is a shortage of the most essential equipment, the safety equipment, the personal protective equipment in our country. But I think it's an issue even the United States physicians are facing. Shortage is there, and basically a pandemic of this magnitude is an event which is seen not very frequently. And most of us are not really, so to say, psychologically equipped to handle things of such magnitude. We have had other calamities like earthquakes and tsunamis and all that, but they are more regional and affects a relatively smaller area and a population compared to what is going on now. So compounded with the fact that we have got shortage of necessary equipment, the magnitude of this calamity is very high. And the solace, or I would not say solace, but one thing that we all of us need to look at, whether we are at the front line or whether doctors like me who are sitting at home or sometimes in the clinic, because I try to go out as less as possible. So whenever I am talking to my patients, whether it is a patient or
Right.
somebody who is a doctor or has worked on the front line, my advice is you will need to look at it one day at a time, one patient at a time, and one task at a time. This is to keep the unnecessary anxiety away. The
Okay.
anxiety is going to be there. The resources probably, as we know, are not going to really measure up to the amount of work that we have. Yet, we as frontline people, the doctors, the attending staff, the nurses, the whole hospital staff, so to say, the health system, the smallest worker, everyone, in spite of knowing all these things, we'll need to put our best foot forward, because this is where we can actually make a difference, and we can actually see difference in the outcome of our suffering patients. So we need
Right.
to
Right.
be very, 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 I would say being narrow at this point in time will work, because will have got a proper focus, what you need to look at, what you need to get out of it, what you can do, what is the best course of action in that place. Do it,
Correct.
take a break, relax, go on to the next task.
Dr. Dave, with some useful coping mechanisms. Thank you so much for that.
Can
I
I
have
add
to quickly
something?
open the calling lines right now. I have two callers already joining me. I have
Yes.
Rajiv. Sure, Doctor, I'm just going to come back to you. Let me quickly get in a word from two of our callers. I have Rajiv joining me from Mumbai. Good evening, Rajiv. Thank you so much for calling on the last word. Go ahead, please. Oh, I'm sorry. We seem to have lost the line there with Rajiv, but I'm going to try. I'm going to get another caller joining me on the phone line. I have Celine joining me from Mumbai. Good evening. Thank you so much for joining us on Mirror Now. Go ahead, please.
Good evening to you. Thank you very much for having me on Mumbai Mirror now. Hi, can you hear me?
Go ahead, ma'am.
I just want to say
Yes, absolutely. Please go
I have
ahead.
no questions to ask. I just cannot say thank you enough to all the wonderful souls out there who are working for us. Each and every doctor, you're brilliant, you're wonderful, and I'm sending a virtual hug to each one of them. I am sorry for the mindless, the people who have treated them badly. I apologize on behalf of these. I don't even know what to call them, actually, to be honest. It hurts me to see doctors being treated, medical staff being treated badly by certain societies. So sorry for them. Not everybody is like that. We love you and we thank you for what you do for us. God bless you all.
Celine, I think that's absolutely wonderful, and thank you so much. I'm sure you definitely brought a smile on my face, so I can't even imagine, what Dr. Rajkumar and Dr. Ruksheda and Dr. Dave and definitely Mr. Gavande, the kind of, happiness, and more importantly for people like Mr. Gavande, how proud they must be feeling. But thank you so much for that, Celine. It's definitely put a smile on everybody's faces. Dr. Ruksheda, over to you. You wanted to add something. We were talking about the lack of medical equipment and how that's possibly a trigger for anxiety for a lot of healthcare workers.
Like you pointed out, so there are a lot of challenges the medical staff is facing, and you also was you were talking about how people can help and how other people can help who are not really maybe even friends or family of people who are working on the front lines. What you can do is be supportive, just like our last caller was, and be positive, and reassure us that you care. Because we know we care, and we are not only just saying it, but we're doing it by taking care of everybody, medically speaking. Understandably, people are scared, and that's why they can lose patience with doctors and the medical staff. So I would request if you can empathize with the doctors, that they're trying to do their best. They may be tired, or they may be scared themselves, or they may be worried, because nobody likes to see people not getting better. Nobody likes to see, no doctor wants to lose a patient. patient to death. So try, like, what you can do is have patience with the doctors. What you can do is take care of themselves to reduce the burden. And if the doctors of India know that the people of India are being judicious and cautious and taking care of themselves, they'll be relieved. They'll know that the tsunami that's going to hit them is going to be a little less voluminous than they ordinarily would have. What's also going to help the doctors is not really keep forwarding WhatsApp messages and Facebook messages of unauthenticated medical advice. What really would help the doctors mentally as well, when they know that the lay people out there are not really taking medications when they don't need to, and possibly increasing their burden. What's going to really help them is have a kind word for them, not just now but for 6 months down the line as well, because it's going to take that long for all of us, the health service, for people, for us to recover from the burden and the struggle that we are going through. So it's not just about today, it's not just about one day. You want to try and be a little patient with everybody around, and that will help you reduce your fear as well. When you know that, okay, you can talk to the doctor and the doctor is going to talk back to you, you're going to be relieved, and the doctors can do their job better, and they'll feel more supported and they'll feel more comforted. Doctors are trained, they're very good about keeping a clinical distance, being very practical, but they're also, human beings at the end of the day. So if they know that they're cherished and they're valued, and the support staff is cherished and valued, I think that's going to bring more positivity to us. And hopefully, when we also know, then the doctors know that this is definitely going to change their working environments in the near future by the people, by the government. I think that's something that if they know that they're going to get that back, so the price that they're paying for physically as well as emotionally now would be more bearable, I think. So there's a lot people can do, and there's a lot family and friends can do, and there's a lot the government can do for the doctors and the other paramedical staff, support staff as well.
Absolutely. And I think I'm not a doctor, obviously, but I cannot agree more about the unauthenticated WhatsApp news forwards. It's quite upsetting, I can assure you, for even journalists and people in the news to actually witness that and be asked all kinds of questions about the cure, or rather the assumption of what the cure of coronavirus is. So please, viewers, please refrain from doing things like that. Dr. Rajkumar, a mindfulness app that's called Headspace, that has partnered with the NHS in the United Kingdom to provide all healthcare professionals with a free subscription to its mental health tools during the coronavirus pandemic. I think it's absolutely wonderful. Do you think that it's time that India perhaps has the same as well?
Actually, even our own Department of Psychiatry has started the teleconsulting facility. So healthcare workers should be free to consult with the healthcare professionals who are providing free or nominal kind of online services at a nominal price. And it is also important that there are a section of healthcare workers who are not paid. For example, the foreign nationals who are working in AIMS from neighboring countries like Nepal, for example, who are not paid salary. And considering that the lockdown is spread in other Southeast Asian countries, it is important that government addresses their need. Though the Prime Minister had promised salary for the foreign nationals even in AIMS, it is yet to be implemented. So though the government has announced a package of 50 lakh for all healthcare workers and even EHS benefits, these foreign nationals who are working as doctors in AIMS should also get those benefits. So it is important to take care of them both monetarily, psychologically, and all other needs should be met by the Indian government.
All right. Dr. Dave, do you think that perhaps even at a time like this, there is hesitation even from healthcare workers to seek psychiatric help, to seek mental therapy? Just like any of us, a lot of people in India have that kind of hesitation. It's still considered taboo. So do you think that perhaps that still persists even within the fraternity?
To an extent, yes. But I would think that with all the support helplines that are coming up by various organizations, medical general medical as well as psychiatric, this should be taken care of, because uh, people know what they are undergoing, people know their anxieties, people know that they are fighting a lot of difficulty and very very high magnitude of challenges. So the anxiety is there, the apprehension is there, the uncertainty is there, and in times like this where there's a lot of pressure, it's easy for people to open up and seek advice, if not help, and just to see them through, to manage, to tide over their difficulties. So yes, we have had traditionally a lot of difficulties experienced by people in approaching mental health professionals, whether it's a psychologist or a psychiatrist, for their problems. Now help is available. Now they actually know what is happening. They know their limits, so to say. I think that is making it easier for them to approach us, to share with us their concerns, their worries, their difficulties, and we are open to helping them at any time, whether be it with some advice, some therapy, or whatever is needed.
Mr. Gawande, as a parent of somebody who has to work in a high stress environment on a daily basis, and we don't know for how long this is going to continue, and knowing that perhaps your child could be susceptible to anxiety, experience distress, almost have 3 or 5 times more insomnia than anybody else who is not on the front line. Would you recommend perhaps after this that India as a country, and more importantly, we as a population should have more open conversations when it comes to mental health, not just for the general population, but particularly for people who are working in the front line, who are in healthcare, who are medical staff, who are doctors, who are nurses?
Yes, they should get. They should have given the more facilities for that. You are asking me the same thing, no? Hello.
Yes, sir. Yes, sir. Yes, sir. Go ahead.
Hello. Can you hear me? Can you hear me?
Yes, sir. I can hear you. Please go
So they
ahead.
should
Yes.
get the more facilities for these persons. That so, what is your basic question?
So my question
Hello.
to you essentially is, because as a parent, you know that your child is probably more susceptible to anxiety, to stress, because they're working in a very high stress environment, and we don't know when this is going to end. So do you think that perhaps now India, and more importantly our government, needs to
Yeah.
get a little more serious and a little more aggressive in counseling and making mental health an important conversation to be had?
Yes, 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 definitely, definitely. See, government has to do for this most counseling, and they have to do all the things which are required for this. That is my opinion.
Okay, okay. Dr. Ruksheda, a lot is being said about how Kerala as a state should be used as a template in the way they've handled the pandemic, and of course it has to do with how systematic and how well organized the treatment has been and the testing has been. But a lot of unsung applause actually deserves to also go to the kind of mental health importance that they've placed on this pandemic, be it the health minister staying in touch, constantly reassuring and boosting the morale of the workers over there, or even the isolation wards actually being fairly positive places where there's access to Wi-Fi, nutrition is being focused on, and more importantly there's a lot more access to wellness information and literature that's being provided in these quarantine centers. So do you think that perhaps all states should start emulating this, and perhaps we also need to come up with a guideline of sorts, considering we're going to be in this for God knows how long?
So like you said, that they've set a good example. one of the best examples that they've set is communication, where not only are they doing the work, but they're also communicating to everybody about what they're doing in a calm and in a very systematic manner. And as a psychiatrist or a mental health professional, I'm going to tell you that communication is the cornerstone of all health and all well-being. So not only are they communicating clearly with people what they're doing, but also they're seeing to it that the people who are isolated, like you said, do have access to the outside world, so that the sense of loneliness might be a little less. And yes, the mental health professionals of Kerala have also contributed tremendously to this, and I'm sure their inputs and their ideas in terms of how to make this this experience as less traumatic as possible for both the people who are suffering and also for the people who are helping the people who are suffering, the caregivers as well as the health professionals as well as the security professionals and all of that. So as far as if we don't really look at what simple communication, simple empathy, simple reassurance can do, and how, like a good bedside manner at the end of the day, how that contributes to recovery and how that contributes to facilitation of treatment and how that constitutes to better outcomes and success. I think it's important that all of us understand that, and I mean now more than ever. And I think for me, I've always said this, that the young people are not, they're the guiding force, because they have less inhibitions and less stigma about mental health. So I think, they're going to take this forward.
Right, Dr. Ruksheda, Dr. Rajkumar, Dr. Dave and Mr. Gavande and Dr. Shetty, thank you so much for joining us on a particularly significant part of our mental health series that we've been focusing on every night at 10 o'clock. So how we need to perhaps deal with the people who are working on the front line with more sensitivity, check in with them, check if they're okay, and most importantly, please support them. Thank you to all my viewers for joining us. Good night and have a great weekend.